Pat, I wanted to start with you and highlight some of your testimony and focus in particular on the food box, the impact that has on your life and the life of your family. I was interested to read in your testimony that in addition to talking about what the food box means to you, that you said something which was interesting in the sense that it's probably an underappreciated part of this discussion. You said on page 2 of your testimony, quote, "The senior food box stretches our groceries and our budget." And I wanted to have you talk about that for a moment, because sometimes I guess we think of it as just a quantity of food as opposed to having a positive impact in other ways on your budget. Can you talk about that?
I guess I've been talking about my family. Oh, thank you. In talking about my family, our nutritional needs, my husband's especially, he needs the boost in the Ensure along with the protein and vegetables and all those other things. Without the food box, I couldn't stretch my budget to meet those needs. Just to give you an example, his insulin test strips, and we have insurance. You know, we have Medicare and good supplemental insurance. It's still, he's paying out of pocket $75 for the test strips several times a month because of how much testing he has to have done. I don't want to make the decision of his health care versus what I put on the table. I want protein and I want a nutritional, you know, the food elements that we should be eating to keep him healthy, to keep us healthy. And that would go for all seniors. You know, in talking with other people that are in our age group, you know, some of those people really can't afford based on what their Social Security is monthly. You know, I've worked all my life, so mine might be higher than somebody who's been just a mother, you know, not just a mother, but, you know, stay-at-home parent and doesn't have that X amount of dollars put into Social Security. So juggling is definitely a task that, you know, when you're faced with food, medicine, and other needs, it's difficult to do.
Mm-hmm. So the food box is not just the quantity of the food; it's the healthy impact of it. Huh?
Well, it's the nutrition that's in that box. It's the proteins and all those things that are needed on that table monthly to get us through, you know, that we should have for a healthier living. You know, you hope that the cost of medical expenses is cut down because you're eating better, you know?
Well, I was noting as well that I'm not sure I've ever seen a list this long of health challenges for one individual. Your husband, cancer, 2 heart attacks, insulin-dependent diabetic, blood clots, fighting blindness, and you yourself, breast cancer, back surgery, lung replacement, and MS. That's quite a set of challenges.
And I had to quit work because of heart disease, you know. Again, we've worked all our lives, and, you know, to ask for somebody or go somewhere for additional help was a struggle. My husband's a very proud man, and as I said earlier in my testimony, always felt that he should be the one to put the food on the table and to, you know, it was like it was a lot of soul searching to be able to go to the food pantry and accept that food box. But, you know, I'm glad we did. And I'm hoping for other seniors that and again, that I've talked to, it's a blessing.
Thanks, Pat.